The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone, and a warm welcome to the Physica Radio webinar. This evening, Dr. Deborah Zeff will be presenting the powerful integration of essential oils with homeopathy and spagyric botanicals into your clinic setting. Welcome, Dr. Deborah Zeff.
Hi, this is Dr. Deborah Zeff, speaking with you from Colorado today. It's a beautiful day today. Hopefully everybody is having a gorgeous day as well. Today I'm going to talk to you about essential oils. I'm known in our industry in this area as an essential oil snob. So I welcome you. I'm looking forward to sharing a very brief introduction to essential oils. This is by no means a full educational class where you become an essential oil expert in. This is about touching, learning, and feeling a little bit about essential oils and how to integrate them with a little bit of knowledge into your clinic. I myself love the Physica Energetics. So today we're going to breathe in and sniff away. Essential oils integrated with homeopathy, smelling your way to whole body positive health. A little bit of my background is that I have a PhD, and the PhD was done using essential oils to lower cholesterol. So the training that I've had as a clinical aromatherapist goes way back. So that is why, again, I'm known as that essential oil expert or the essential oil snob, and I go around teaching and educating people on essential oils. So my course objective today is to explain to you how the oils help the body in a complementary way with homeopathy. I have homeopathy here in our clinic in Centennial, and I find that it makes a nice adjunct with the healing of the person. We become entangled with that person, and we become mirrors of each other. And so it helps them with that healing. We're going to talk about single note versus blends. We're also going to talk about the psychoneuroimmunology effect of essential oils and how it affects the brain and the limbic system and how the healing occurs. The difference between a beautifully balanced essential oil and one that is adulterated or compromised. We're definitely going to get into some of the safety rules, and there will be an attachment to this so that you can have the safety rules by your side every time that you go to use them. Methods of disbursement that we use here in the clinic, and methods of determining if an oil is appropriate for the client. So introduction. What is aromatherapy and where does it come from? We know that it goes way, way back, but how far back and what did they use it for? The safety, to be knowledgeable on the care and use and strength of the oils. There are lethal dosages of essential oils, and so knowing your oils and how to use them, whether they're caustic or not, is very important, and we'll go through some of that today. History from its beginning to its use today, and how to use it with the Aperture Energetics healing, especially with the RCCP and aromatherapy, how they work in conjunction with. The blends, the combination of oils, on how they work versus a single oil. The key oils of commonly used ones that people use on a single note, and what is important to know about the quality of oils along with the hierarchy of oils. So introductions. The doctors once were trained in medical botany. It goes way back. I mean, it goes as far back as the traditional Chinese medicine using it. I mean, even Cleopatra used it in her baths with her milk, and that's why they say she had such beautiful skin. Frankincense was big back then. And then in the late 1700s, early 1700s, as well as the 1800s, the French were using it quite a bit. And they used to go around with cups, the big white cups, and they would put essential oils in those cups to smell good, because they didn't always get to bathe, and heaven knows we needed those essential oils to cover up those smells that people were running around with, having no water and not being able to wash correctly. And so the essential oils helped them. And then when the Black Plague hit, it was all about who was using essential oils. The ones that were accustomed to it, immune to it, actually survived the Black Plague. Those that were not using them at the time and had the water and were able to wash, most of them did perish. So the essential oils helped keep that disease at bay for the ones that were using it on an everyday basis. So now, in the early 1900s, doctors started to embrace the chemical medicine. And I think this was part, I believe, a downfall of today's society. We forgot to go back to our roots. The drug companies influenced health industry toward pharmaceuticals. And we know that pharmaceuticals is a chemical that is entropy. It's dead, and it's not made for our body. So now, again, we've come to this new science that it's being realized that many ailments do not respond well to drugs. So there's a great article that CBS came out with, and there's the link that's attached, with Allium ursinum. Now, we know that Physica has a beautiful, beautiful wild bear garlic, and that it helps kill the MRSA, those superbugs that are out there. So it's a natural antibiotic, and that's where bringing in the aprogenics remedies, working with the nutritional supplements along with the homeopathy of Aperture Energetics will work beautifully with the body. Europeans have maintained a dual philosophy using both modern drugs and the botanical approach. When we lived in Germany, I would go and hang out with the pharmacists. I was in my deal about trying to learn the most that I could, having already done much of my training in body work, therapeutic touch, massage therapy, reflexology. And I found if I went there and hung out with the pharmacist, they would show me which herbs to mix with what. And we know that all of these herbs, that God has given us everything here on earth to use to help heal our body, because it vibrates at that same frequency. So the pharmacist, if you would have a prescription from a doctor, the pharmacist would say, well, do you want a natural healing or do you want a chemical? And so it was your choice. Unfortunately, we don't have that yet in North America, and I think with the legacy that Dr. Cass is trying to put together, you know, it's coming. We just have to hang on. Aromatic medicine is a branch of that botanical medicine. Remember that the essential oils come from the plant. So what is aromatic medicine? Aromatic medicine is energies released from nature. The essential oils, hydrosols, and carrier oils used for the maintenance of health and the treatment of dysfunction and diseases. It is through hundreds of decades of human experience that we have our knowledge of this beautiful natural medicine. We need to have respect for the plants that give us these energies, because the essential oils are the lifeblood of the plant. And we have to have respect and reverence for them, because that is something that vibrates at that vibrational frequency with our bodies versus the chemicals that the pharmaceutical industries are trying to put into our bodies, and the fillers that are now with the GMO and the chemicals and the pesticides and herbicides, and I'm sure in our clinics we've all come across that. So what are the biological components of the aromatic medicine? We have, as mentioned, the essential oils, the hydrosols, the carrier oils, and the macerated oils. So we are going to talk about those. So the essential oils are the compounds contained in essential oils are lipid soluble. They like to dissolve in the fat compartments of the body. An oil substance that can be extracted by various means from plants, which are volatile, which means that they rapidly diffuse into the air. They can be used for external as well as internal applications when and only when under a clinically trained person, okay? Please ensure that you understand that essential oils should be used with a person that has been trained clinically, not just an aromatherapist. So I have my aromatherapy certification. You can get that on a 3 or 4 month weekend classes. This is all about making sure and ensuring the safety, just like homeopathy and physica. That's why we go through so much training. It's to understand what you're giving to the patient and the clients. Same thing with essential oils. Hydrosols is one of the end products of steam distillation of the plants. These are waters which contain compounds which are water soluble. They like to dissolve in the water compartments of the body. So you have essential oils that are dissolved in the fat solubles, and the hydrosols dissolves in the water solubles compartments of the body. They are also known as hydrolytes and floral waters. They can be used for external and internal applications. Hydrosols of rose is a beautiful, beautiful water to drink when you have challenges intestinally. The hydrosols of rose and frankincense together is beautiful for cancer patients. Carrier oils. These are oily substances expressed out of fruits, nuts, seeds, which are not volatile. They are used alone or in conjunction with essential oils for internal and external applications. An example is the oil of sweet almond, or the fractionated coconut oil, or organic olive oil. Those are all carrier oils. The last but not least is the macerated oils. These oils are carrier oils that are produced by taking a carrier oil and placing another type of plant material into the oil, such as a flower, the marigold, or the arnica. Material is left in the oil for weeks or months and then strained and bottled for use. So you could take your marigold and put it in your organic olive oil, break it up, and let it sit in the jar for 3 to 4 months, and then you would strain that. And the marigold is a beautiful macerated oil. So is the arnica flower oil. It's beautiful. It absolutely helps with bruising. It helps with soreness, with pain. So how are essential oils made by the plant? So here's a cross-section of a plant cell. So perhaps you can follow along as I talk about the plant cell. So we all know that the sun is an energy system that lives off electrical, magnetic, and particle energies that are captured by specialized cells in plants known as the chloroplasts. Down on the bottom left-hand side, you see the green chloroplasts. These cells make glucose, a simple sugar from carbon dioxide and water. Does that sound or feel familiar? Do we not have glucose in our bodies as well? The glucose molecule is then acted upon by various enzymes under genetic control and make the hundreds of precious compounds which we find in essential oils. The name of the plant identifies its botanical origin. This is one of the most important aspects for identification of genuine essential oils. There are many families of plants. A plant family is one which has common characteristics of reproduction, metabolism, morphology. For example, the Burseraceae family. So when Dr. Cass formulates his homeopathy, he takes many families and it brings it into the homeopathics, which I absolutely love because we know that some families have different healing properties than others. Within the family, there are one or more genuses, and each genus will have one or more species. Some species will have one or more chemical varieties called chemotypes. Now, this is one of the educational seminars that I won't go into, the chemotypes, with the carbons, with the oxygen and where they attach and whatnot. That gets into more of a detailed of one of those 30 and 40 In the case of rosemary, the entire plant is being used. You see here a picture of the extraction method, and I'll get to that in a little bit. I wanted to explain to you how and why we use different parts of the plants. So I talked about the rosemary. The entire plant of rosemary is being used, and you'll see that in this distillation method on the top part of the plant. In the case of bitter orange tree, the plant part is critical. The oil from the peel is called bitter orange oil. The oil from the flower is called neroli. And neroli was one of those plants that was used in Egyptian time. Beautiful smelling, great for the skin. The oil from the leaves is called petitgrain bigard oil. So petitgrain means petit grain, which is the French word. Petit means small, grain is the grain of the oil, the droplet of the oil, and it's very, very small. And petitgrain and neroli and bitter orange all come from the same tree, but they all have different healing properties. The chemical constituents and the therapeutic properties are all quite different. Another example is lavender essential oil. The highest quality comes from the flowering leaf. If distillation is done incorrectly and some stem is also distilled, the quality will be inferior. It will not be the same. So the most common extraction method used is distillation, as you see in this picture. The plant material is placed in a vat which steam is injected. This causes the oil in the plant to be released with the rising steam. The steam moves through the glass. You see the glass tube on the left-hand side. And the oil and water is separated. So it falls down through the steam, comes down into the bottom part. The oil is called essential oil, and the water is called the hydrosol. So the hydrosol on the bottom, where you see on the right-hand side of the slide, you see that there's water there. That goes up into that tube, and you'll see the water comes up on the bottom right-hand side, and the essential oil will float to the top, and the water will go to the bottom. Remember, oil and water doesn't mix. For the therapeutic grade distilled essential oils, the process is modified by attaching a vacuum pump to the container chamber. This lowers the temperature at which the oil is then released. So we know that oil and water does not mix. That is why people will go and have a bath and say, oh, I put essential oils into my bath. Please don't do that. And we'll get into that with the safety of the essential oils. But when we start talking about the hot and the cold distillation of the plants, we know that those hot and cold methods, we need the colder the better. Because if it gets too hot while we're distilling, we're going to lose the properties of those essential oils. That's why a cooler method of essential oils, cold-pressed olive oil, or your cold-pressed sweet orange oil, is better than something that had to use very hot water to get it steamed out. So odor evaluation, testing for purity. What you see on your screen right now is called a chlorinated pesticide. So you see all of these different properties of the pesticide that's being tested through a gas chromatograph and a mass spectrograph. And so through all of this is one of the methods. A few of the other methods are the odor evaluation. A nose that has been trained on fine oils will spot an inferior oil very quickly. Some of us have the beautiful ability about picking up that essential oil and feeling the vibration in it. And I know some of you docs out there have that ability as well. You can pick up a homeopathic and know this is a great quality oil, or this is a great quality homeopathic product, versus one that is not. It just vibrates differently. It has that higher frequency in it. Same with the essential oils. The gas chromatography, or a GC, is the most important method used to check the quality of chemicals in the essential oils. Most therapeutic grade oils from reputable distillers will have the analysis available for your examination. The question is, does your distributor cut the oil? Does your distributor take the oil from the distiller, and the distiller will give them the gas chromatograph, and then your distributor will take it and say, well, you know, it's really expensive oil. I'm going to cut the oil with chemical or an inferior oil, put it together, and sell it for a pure oil. So you have to have trust in that distributor that he's not doing that, unless you are getting oils directly from your distillation process, from your distiller. So does your distributor cut the oil or not? Have the trust, because you can ask for that gas chromatograph directly from the distiller versus the distributor or your wholesaler. Where does their oils come from, and do they have lot numbers on them so they can go back and find out which batch that they're from? The mass spectrograph, which is an MS, analysis of the oil, yields the exact atomic structure of the molecules in the oil. So what you're seeing on the screen is the mass spectrograph. So would you like a distributor to give you the GC as well as the MS? You betcha. When I did my research for the PhD, I wanted to make sure that my distributor, my wholesaler where I get my oils from, because I was doing that PhD research, I needed to ensure that that oil was pure and organic and safe, and I was looking for the properties, the chemical constituents of that oil to ensure my outcome was going to be correct. So very, very important. So the gas chromatography, this is a picture of that. Specifically, gas liquid chromatography involves a sample being vaporized and injected into the head of the chromatographic column. The sample is transported through the column by the flow of inert gaseous mobile phases. The column itself contains a liquid stationary phase which is absorbed into the surface of an inert solid, so that you see it goes through the carrier gas, it's injected into the port, the oven looks at it, goes to the detector, and then it is recorded. And all that goes back to that mass spectrograph that you were looking at. So adulteration. Each essential oil has a fingerprint made up of the ratios of certain chemical constituents. When the gas chromatograph, mass spectrograph, shows that certain ratios are way out of balance, one can strongly suspect adulterations. So that GCMS is very important for you to have. Adulterations may be accomplished in a number of ways. By adding an inferior grade of the essential oil, by doctoring the aroma with synthetic chemicals, which we know are available out there, and some companies out there do that. That's why they can take a very expensive oil and distribute it and have lots of it, for example, frankincense or spikenard. Spikenard is very well known for varicose veins and skin healing properties. And so many companies will take it and cut it and sell it as a pure grade, and then you're not getting the results. And so that's another reason why you want to make sure that you have full gas chromatograph, mass spectrograph, that GCMS, to show that it's purity. By doctoring the aroma with a synthetic chemical. So that synthetic chemical will enhance the smell. So the fake perfumes will enhance the smell, and they'll go, wow, that smells really good, this is awesome, versus, you know, that lavender really stinks. And I don't know if anybody out there has ever smelled a true pure lavender. It's not the best smelling. Neither is spikenard that I mentioned. Spikenard smells like dirty, rotten socks. I mean, really, to bring it down to it, but it's purities, and when you blend it, it is even better. To substitute a different genus or species that has a similar smell and color and mislabel it as the desired product. This is one of the reasons why I find that Physica, between the vibration of what Dr. Cass brings in with the essential oils, is a beautiful blend together, because you're working with the mind-body connection. In my clinic, we work as a mental, emotional, spiritual aspect to help heal the physical. And so we want to make sure that how they're thinking with their software programming is, how their brain is functioning, what viruses are they bringing into the body, into the brain, so that the body takes that information. We want to make sure that it's all in combination, as Dr. Cass says, in the right sequence at the right time. Right? We need that. Same with the essential oils. So with the adulteration, the best way to avoid it is to do business with distillers and suppliers who value their reputation as a dependable provider of organic and well-crafted therapeutic grade essential oils. And again, this is why I use Physica. There's no higher vibration from remedies that I have found out there in my 10 years of using homeopathy. Been using essential oils for way over 20 years now, and so it's very, very important to know the vibration, the healing properties of what you're using, as well as where it comes from. Essential oils are made from plants. They're the living substance of it, and they have a life force of their own. Chemical matter cannot regenerate this life force, ever. Remember, that's syntropy versus entropy. Beautiful, beautiful with the essential oils as well as the Physica remedies. So we're going to go through some of the rules for essential oil safety. I won't go through all of them that's on the slides. I'm sure you'll get a copy of them. It'll be an attachment that you have that I put together for you. So I'll mention a few here. Essential oils must be diluted with some type of vegetable oil. Remember, oils and water don't mix, so you need the carrier oils that I talked about previously. I like to use fractionated coconut oil because it does not go rancid. The olive oil, or not olive oil, grapeseed oil, the almond oil, they go rancid quickly. Usually as soon as you open up those jars, within 5 days of you opening that up, it starts to go rancid. The fractionated coconut oil, because of its properties, it never goes rancid, so it's beautiful to mix in your blends. Essential oils must never come in contact with mucous membranes and sensitive skin areas. So if you're taking it internally, hello, your mouth is your largest mucous membrane. I know sometimes it's like, can you please just like shut the door and paint the door red and tie me up in a chair? Because some of these things that people ask questions on because of how they've been educated in, and it's almost like the educator didn't know what he was educating the people about. It's one of my pet peeves, and that's why I'm known as the essential oil snob. My little hairs on the back of my neck go up and say, come on, we can't put this in our mouth unless it is with something that's going to bring it down into the intestines, and we're going to talk about that later on. But just remember that those very precious mucous membranes, sensitive skin areas, that essential oils must never come in contact with that. Never add undiluted oils to bath water. Again, it doesn't mix with water. Oil and water don't mix. So this is where you want to mix it with milk. And the heavier the milk, the better, or bath salts. So I like to take a half a cup of bath salts with about a cup of heavy cream and add my essential oils into it. Let it sit for a minute, mix it up. About 2 minutes before I get into my bath, pour it into my bath, swish it around, and get in. And so you're getting the vapors, the volatile essential oils, and the milk is great for your skin. Remember Cleopatra? She was beautiful. All essential oils are flammable. Please don't put them beside a candle or say, oh, there's some wax on the candle and I'm going to make my candle smell pretty. It doesn't work. You're going to cause a huge fire. Ensure that your essential oils are of impeccable quality. That's a hard word for a French Canadian. Impeccable quality for internal use and under the direction of a qualified practitioner, qualified people. The last one I'm going to talk about is children under 30 months should never have menthols used near their throat, neck, or mucous membranes. Okay, so here's a question. People go, all right, I'm going to put it on my baby's feet. I know as an adult I cannot put my foot in my mouth, although I have on many occasions speaking felt like I put my foot in my mouth. However, people forget that children can do that, and so they go and put essential oils on the baby. I'm going to go use peppermint on my baby's feet because it has a cold. Okay, so the first thing babies do is rip their socks off, so don't put the socks on unless you're going to duct tape them to their legs, right? And we don't want to do that. So you don't want to use the menthol on a baby at all. You want to be able to take a peppermint or a spearmint. All of those have menthols in it. So there's other things that you can use that'll be much better, and we'll get into those a little bit later. Always have a carrier oil of good quality. Remember that some carrier oils go rancid sooner than others, so make sure that you remember that. When we go to test for essential oils, make sure that you test on the soles of the feet. That's the best place for that. And some essential oils have strong caustic phenol characteristics and should be used in a diluted form. For example, savory, clove, and cinnamon. That's great for arthritis joints and whatnot. If you're going to put it directly on the skin without diluting it, make sure you have a carrier oil right beside you because it may burn and it's going to actually leave a red mark. It's going to burn. So please try not to do that. So the safest place is on the soles of the feet. We're looking for, when we're doing a skin safety skin test, burning means too strong, redness means too strong, itching means allergic reaction. Okay, very, very important to make sure you do that skin test. So how to disperse or dilute? So by using a nebulizer, a device that reduces the large molecule to a smaller one. And so a beautiful nebulizer, there's different kinds of them. And so it's very important to know and understand which ones are going to be in the body and in the air and how you're going to disperse them. So modes of actions of essential oils used in aromatherapy and why we use them. One is the psychotherapeutic effects of the oils on the olfactory system in the brain. The absorption into the circulation of the oil's constituents chemicals via the nasal brain and lungs. So one of the reasons why we use the nebulizer, and we have one in the office that we get people to breathe for 10 minutes of the essential oil, the pure essential oil in a nebulizer for 10 minutes, no more than 10 minutes because of the caustic effects of the essential oils and the lethal dosages. So for muscular problems, you use a much higher percentage of essential oils than normally used in a massage or rubbed in. Or you would use a higher one if you were going to do a compression. So you would put essential oil in water, take a towel, put the warm towel in the water, wring it out, and do a compress on the body. So the method would be 1 drop of essential oil in a tablespoon for a baby. And for adults, it would be 6 to 12 drops of essential oil in a tablespoon, depending on the age. For adults that are 12 and over, you would use 6 to 12 drops depending on what is being affected. Are you using it for a massage while they are sick, or are you creating a massage that is, you want it directly to go into the body? Remember that damaged skin can often benefit from using a healing essential oil and fixed oils. This form of treatment may not be strictly aromatherapy, but it is closely allied. This is because the essential oils can have a direct pharmacological action on damaged tissue, as well as indirect benefits, the beneficial effects on the mind if the aroma is perceived as pleasant. So again, the nebulizer is huge. We use the nebulizer here in the office. People, instead of burning candles at their home, they use the nebulizers. By direct application to the affected area, make sure that it is a carrier oil. Remember, 6 to 12 drops depending on where it's at. The only exception to this rule, and you'll learn this if you're going to pursue being an essential oil therapist, is lavender. Now again, lavender has different healing properties, and there's many different types of lavender and quality of lavender. And so lavender, the French lavender, Lavender Vera, is the highest vibrational frequency. Now, its vibration and healing properties will be affected in different ways depending on when they've harvested that essential oil. So did they harvest it in the morning with the morning dew? Did they harvest it during the warm sunshine when the plant was warm? Or did they harvest it in the evening under a full moon? That will all be affected because our body, for example, is 70% water. And we are affected by the moon, just like the moon affects the tides. And so same with harvesting these oils. And so that's another question to ask your distributor, when was the oil harvested? And that has to go back to the distributor or the distiller to find that out. Another way to disperse is by mixing it with milk, and we discussed that, by applying it to a cotton ball or other absorption material. So this is where my teachers come in, who have these classes of these beautiful, beautiful crystal children who can do 20 things at once and have an absolutely high brain, high excitatory state throughout the whole day. They bring in cotton balls, put essential oils on the cotton balls, put it in the corner, and all of a sudden they're learning more, they're learning better, they're quieter, they're able to absorb because they can focus better. And so it helps with these children in the classrooms, and the next thing you know, you've got all of the teachers hanging around in that classroom because it's a beautiful smelling classroom and everybody's actually, wow, this is a nice vibrational classroom. It feels good, it smells good. And so cotton balls are a great way to do it, especially if you can't have a nebulizer. So I have here, by adding to hot water to inhale steam and drink after 10 minutes. And the reason we can do this is that you can add 1 drop to your cup of tea and sit there and inhale the steam from that cup of tea. After 10 minutes, all of the volatility from that essential oil, or most of it, has dispersed. It has gone into the air, it's gone into your olfactory system, and your body is taking it in through you inhaling it. The other way that you can disperse essential oils is by spraying it. Remember, oil and water doesn't mix, so if you're going to have a spritzer, make sure that you shake the spritzer. The water and the oil will go through the spritzer and make it into a smaller molecule. So here is an example of one of the nebulizers that we have in the office. You can go to www.diffuserworld.com, and Jeff there is absolutely fabulous. If you become a distributor for his, you get your prices less. You have to buy them in bulk. But diffuserworld.com is an absolutely beautiful place to get the nebulizers. Here are other different methods, different kinds. They look pretty, they're great. I find that when you're using these open types of diffusers, that the essential oils, you have to have like a cloth or something underneath these, because as soon as you put your essential oil on wood or plastic or anything like that, it's going to eat through it. So don't forget that. It's going to eat through it. So pleasant aromas. Here are some research that was done in hospital settings, and you guys can definitely go through that. Essential oils help improve and has reduced pain, and the patients got better faster. So here are some of the things essential oils can do for your patient. Now, these are very similar to what our beautiful, beautiful homeopathy pharmacy can do for us as well. So when you put them in combination of Relax Milieu and the HPA Axes and the Ultimate Fields and the essential oils together, they will help reduce your stress, reduce anxiety, increase alertness. Now, not all aromatherapy is equal. Remember that. So essential oils do different things, just like herbs do different things for the body. Remember, I talked about in the very beginning that the Allium ursinum for MRSA was fantastic, and there are the essential oils that can help fight infections as well. So here's another reference from research that sex differences show that a woman has, as a whole, that women as a whole are more responsive to aromas. And perhaps, you know, my thinking is that we are girls and perhaps we're a little bit more compassionate and we easily tear up and we have a lot of love to give, and I think that as on the negative side, we're more martyrs. We do more martyrism. I'm going to give instead of sharing. I want to do everything for everybody. And so that becomes just a little bit more, we're sensitive. I know some men are sensitive too. I know I've trained my husband he's German, so I had to chainsaw him and then sandpaper him and then, you know, water jet him to get him to where I needed him to be after 28 years. And so he's now more sensitive too. But anyways, it's one of those things that the pleasant aromas help our bodies heal. Here's another research about asthmatic children. When given a sniff of vanilla along with an inhaled bronchodilator, were later just given vanilla, 33% showed an improvement. Isn't that amazing? These are great places for you to go check out. Here's another one about depression, and depression is an immune expression of inflammation. So the German chamomile is high in camozuline, and it's an anti-inflammatory. So go check out this research as well. So here's a sample of some relaxing essential oils. I've given you the Latin name versus the English name that we use. So beautiful lists. I love them. If you have any questions, let me know on them. Here are some stimulating essential oils. Remember, we don't really want to stimulate our ADD children, and so we want to make sure that we don't have any of these around an ADD child unless they are in a blend. The hyssop and the rosemary, when we talk about children, are beautifully blended together for lung issues. And the basil is beautiful for the higher vibration blended with frankincense to help us connect to the divine, to bring in that software programming at a higher vibration. Mix those two together with a little bit of cardamom. Now you'll notice some of these are actually oils, essential oils that are mentioned in the Bible, so you know they've been using them for more than 2,000 years for certain things. So the stimulating oils are beautiful. If you are going to use them, mix them together, as I said before, with milk or Epsom salts or a bath gel, and then place it in the bath just before you get in. Aphrodisiac oils. Of course, this is my man's favorite essential oils. He loves the sandalwood and the jasmine and the orange sweet mixed together. The sandalwood is also relaxing. It helps you sleep. So maybe it's a blend that you could put together for some of your patients or clients that need that rest before they go to sleep because they have insomnia. So one of the reference books here is from Dr. Robert Tisserand. Beautiful man, fantastic man, very knowledgeable. He's written a new book, just came out with it last year, or 2 years ago, can't remember. It's on my shelf. I only use it for reference. I use my books as references. Sometimes I don't remember the names of them. It's like, oh, it's that yellow and black book. Anyways, here's some refreshing oils. Now you notice that some of them are the same, like the lavender and the basil and the peppermint. Peppermint is huge for pain, huge for pain. You can take the peppermint, mix it with a little bit of coconut oil or olive oil and rub it on sore muscles. Have a bath with the peppermint. Have a bath with the lemon. So they're going to relax you as well as refresh the mind and the body with it. So psychoneuroimmunology, what is it? Because essential oils affect our body, this is one of the reasons why I needed to have this in here. So the psychoneuroimmunology is a branch of science that studies the effects in the body and on the immune system from the mind and emotions. So when we use essential oils, we know that we're smelling it, it's going to the limbic system, and it's going to help the body because the limbic system is the oldest part of the brain. So we're bringing that in, and essential oils are a tool. Homeopathy are nutritional supplements from Physica are also a tool that helps the cells connect for that communication within. We need that flow going in as well as that flow going out. We need that whole body movement. So the essential oils is one of the tools that I use here that helps that flow. Psychoneuroimmunology is relaxing and calming when the proper oils are used and can be used especially during a distress situation. In low concentrations will give calm and sedating effects. The client should be allowed to smell the oils to be sure they agree with them. And some examples of the calming oils are the French lavender, the helichrysum, and the sweet orange. I didn't put helichrysum on the common oils because helichrysum is one of those oils that is very expensive. Most of the time, if you're not understanding your distributor, that helichrysum oil is cut. And so the purity of it, you can usually get a helichrysum oil, say a 3 to 5 ml bottle of helichrysum for approximately $120. So that's not a lot of helichrysum, but you don't need a lot as well, right? If you're smelling it great, you add 1 drop in some olive oil or fractionated coconut oil. So it's, as you can see, it affects the nervous system, the endocrine system, as well as the immune system. Eucalyptus trees are native to Australia and have about 800 species, but we get very few from them that yield essential oils. So I'll narrow it down by going down to 3 species, those that support winter ailments. Remember, the winter ailments aren't only in the winter anymore because of the superbugs. So I will have different essential oils going in the clinic at different times. So the 3 species that I selected for these oils are the Eucalyptus globulus. You'll never use that on a child under 30. The Eucalyptus radiate cyber. I call it Eucalyptus radiata. Or the Eucalyptus smithi. These are beautiful essential oils for the respiratory system, from the sinuses to the pulmonary alveoli. We're going to talk about the olfaction. This is the smell of science, and this is the primary way to determine the appropriate oils for you. I will take essential oils when my ADD, ADHD children come in, and I will put 10 in front of them, approximately 10, and I'll watch how their pupils dilate and how they move when they're smelling, and that's how I determine which oils they're going to use. So let's take a look at this olfactory system. When essential oils are inhaled, the molecules rise from the top of the nose to meet the olfactory mucous membrane. The olfactory membrane has thousands of receptors that identify the smell, and thus the sensory stimulation is sent through the olfactory bulb, which acts as an amplifier through the olfactory nerve into the limbic system of the brain. This is the oldest area of the brain. It deals with emotional and psychological responses. The scent is compared to a scent known, which is there compared and labeled. Then we can have memories associated with the scent information, and we react emotionally and physically through our autonomic nervous system. So think about this. When I was a child, my grandma used to make, my mère used to make candy with peppermint. Now, at one point, it was so good, of course, we have to have a lot of it. And what happens when we eat a lot of candy, too much candy? We go and throw it up. So, not a good thing. That's a bad memory. It's a great memory of mère, but it's not a good memory of peppermint. And so, later on, when you go to smell that peppermint, it took me quite a while to say, okay, peppermint's not so bad, it's great for pain, I'll put up with it, because my body had that memory of eating too much peppermint. And so really important to understand and underestimate, or don't underestimate, the properties of peppermint and what that memory in the limbic system can do. So these responses are determined by the specific qualities of the essential oils being used and can range from relaxing to stimulating. The nerve impulse in the limbic system leads to other areas of the brain that are responsible for secreting hormones and regulating body functions. The entire process from the essential oils with the inhalation of the oil to corresponding gland secretion takes place in a matter of seconds. Therefore, a simple inhalation can cause changes in the body from stimulating the immune system to initiating the digestive system into action and so on. Really, really important to know this. And this is why what we're doing in our clinic right now is doing some research with the heart rate variability. We do a heart rate variability before I do an EAV, and we balance them out with the products from Dr. Cass from the Physica Remedies. And then for 5 minutes, I get them to breathe in a specific essential oil blend, which was created for the chakras, which was created for each of the organs and systems at different parts of the body. And then we reassess them with the heart rate variability, and we're finding that we're having a 40 to 80% difference because we've added that essential oil to their protocol. So far, we've been doing it for 2 months now, and we're seeing that the adjunct, bringing in that other tool with the homeopathic remedies and the essential oils is increasing that ability for them to heal. We talked about the skin on how to put it in, and we'll talk about the dermal absorption in a minute. Seeing this, I want to talk a little bit about the oral ingestion. And the oral ingestion, taking essential oils by mouth, the studies show that taking these essential oils internally are the least effective way. Did you get that? Least effective way to absorb their therapeutic properties. The oil ends up in the digestive tract where it has to pass through the stomach and small intestine before it reaches the bloodstream. Remember, it has to go through all of the gastric juices and all that stuff. So from there, the oil molecules, which by now have been chemically altered by the materials they have come in contact with in the stomach and intestines, will reach the liver, pancreas, reproductive organs, and eventually be excreted via the kidneys, bladder, and large intestines. It is not advised to ever take essential oils internally unless under the direct advice of a medical doctor and or a person who is a registered clinical aromatherapist. Okay, so if you're taking them pure, they're going to get half destroyed going through the body or 9/10 destroyed going through the body. Not good to take it. How some of the doctors will do it, they'll create capsules. And the capsule, it'll be nine drops of olive oil, a cold organic pressed olive oil with 1 drop of essential oil in a large 00 capsule. Really important to know that if you're going to do it, and please don't do it if you are not trained to do it. I don't know how much I can emphasize that. So dermal absorption. The skin is relatively permeable to fat-soluble substance and relatively impermeable to water-soluble substance. Essential oil molecules are so minute that when they are applied to the skin, they are able to pass through the stratum corneum, the outer layer of the epidermis. From here, the oil molecule passes through the dermis, into the capillaries, and into the bloodstream. Absorption also occurs through the hair follicles and sweat ducts. There are many factors that affect absorption of an oil molecule. Both rate of circulation and the warmth of the skin increase blood flow to the surface, therefore increasing the skin's ability to absorb the oil. So we want to make sure if you're going to put it in through the skin that the skin is warm. Circulation and warmth can be increased by massage. The larger the area of the skin that is covered, the more essential oils will be absorbed. The permeability of the skin is also a factor. So thinner skin, skin behind the ears and the inside of the wrists are very permeable. The palms of the hands and the feet, armpits and scalp will more readily absorb oil molecules than the arms, legs, belly, and back. Oils are also easily absorbed through cuts, scrapes, abrasions, burns, eczema, etc. So here's a cross-section of it where you see the hair follicle, the sebaceous gland, the sweat glands, and whatnot. So having clean skin is also beneficial as the skin pores will be clean and free of dirt, which may impede absorption. That is why in our clinic we have the far infrared sauna, we have to warm up the skin, and we'll do that before any type of essential oil therapy on the body. To get them to do breathing for 5 minutes is easier than the far infrared sauna. But the far infrared sauna, if they have a cold or they have fibromyalgia or they're having muscle pain, joint pain, we'll have them do a far infrared sauna before they even go to have a microcurrent, which our technician uses essential oils on the body because the microcurrent then pushes the essential oils into the body. Here are some additional info and contact information. Alliance of International Aromatherapists, if you're looking to get more education, there's many schools out there that do it. There is some classes through the IQUIM University, iquim.com, IQUIM.com, where I have 3 educational courses there. Dr. Raphael D'Angelo and his wife Nancy. Dr. D'Angelo is where I got my clinical aromatherapy through. I don't believe he's doing it anymore, but they're still teaching the classes. And they still sell the essential oils. Essential 3 is where I get my oils from. And Kelly Pure Essential Oils, beautiful, beautiful essential oils from there. I highly recommend those 2 places. So how do I get to know and feel and sense the oils? One is go to an essential oil conference. And usually they're more related to health, where nurses, nurse practitioners, doctors go to, and we just happen to be having ours this year. The Alliance of International Aromatherapists is having one every 2 years, and this year it's in Denver, celebrating our 10 years. Go there and feel the different essential oils and the different distributors that are there. Pick up the essential oils, smell them. Do a field trip to identify wild-crafted botanicals. This will help with the physical products as well as your essential oils, because then you'll understand where Dr. Cass is coming from when he talks about the wild bear garlic, or where he talks about any of the other, his fish oils and whatnot. Pick them up, feel them, sense them. Do that with the love and the passion that's gone into those products. You'll feel the same thing with those oils. Try distilling your own oils. You can usually get your own distiller pretty inexpensively on Amazon or wherever. Do litmus tests. Find top notes, middle notes, and base notes for essential oils. Make fresh tea from your herbs. We have a huge herb garden. Everything in our garden is edible, from our herbs to our flowers to, and so it's quite important. We bring them in, we serve them to our patients with 1 drop of a beautiful sweet birch from Canada, of course. Read the Natural Home Healthcare Using Essential Oils from Dr. Pénoel. Beautiful book. The Essential Oil Safety by Dr. Robert Tisserand, which I mentioned before. Shirley and Len Price, I love their book. I use it a lot for references, for research. Here's are more references. I have all of these books in my clinic, but I just had to share them all with you. You'll notice that the names are some of the names are repeating. Dr. Jane Bunkle is actually teaching her class, presenting at the conference. Kurt Schnabel, Dr. Kurt, is not showing this year. Unfortunately, he had to back out. But there was Robert Tisserand, I believe, is coming this year again. He spoke last year. So one of the things that I'd like to share with you is I write an e-sign probably every 2 months, twice a month. And at the end of it, I love to say, may your eyes be open to see the miracles every day, and may your ears be open to hear the whispers from above and from within. So use that information. Go out, have a beautiful day. Thank you for attending this awesome seminar with Physica Energetics. And if you have any questions, please feel free to contact me. So go out, breathe in, and sniff away. Use those essential oils integrated with homeopathy, smelling your way to whole body positive health. God bless.
What an excellent presentation. Thank you, Dr. Zeff. Physica Energetics is presenting our annual Concordia Conference in Santa Barbara, California, October 23rd and 24th. Additionally, 2 specialized pre-Concordia sessions will be offered by Dr. Brockenshire and Dr. Cass. To register or for more information, please contact the registrar today at 1-877-691-5442, extension 102, as these 2 exceptionally popular events have filled up very quickly. Once again, thank you for joining us this evening in the spirit of the Legacy Continuum, healing for the pattern of life.